Our healthcare workers for Palestine, South Africa are out in protest today, gathering outside hospitals across the country. Demonstrations are taking place at 16 hospitals in 6 cities as medical professionals call for an end to what they describe as Israel's weaponization of hunger in Gaza, while also demanding protection for healthcare workers and facilities under attack. The action, they say, also highlights the broader need to safeguard healthcare in Palestine, South Africa, and globally. We are now joined on the line by Dr Farzana Araie Sterne from Healthcare Workers for Palestine, South Africa, to unpack today's protests and the message behind them. Dr Sterne, good afternoon, and thank you for joining us on Africa Update.
Thank you so much for inviting me here again.
Now, Dr Sterne, what is the central message behind today's protest outside hospitals?
All
right, Dr. Sterne, I'm going to ask Tracy to try to call you on a better connection because we can barely hear you. That's Dr. Farzana Araie Sterne from Healthcare Workers for Palestine, South Africa, and she's about to let us know exactly why they're out in protest. And Dr. Sterne, are you back on the line with us?
Yes, I am.
Okay, that sounds a lot better. All right, so let's stick in that spot, and then let's unpack exactly why you've decided to protest outside hospitals.
So most of our members are healthcare workers, and it's very difficult for them to actually leave their place of work in order to go to another site to protest. Also, hospitals are places that have good transport networks. They're close to taxi ranks and bus stops. So this allows more people to actually attend the protest. And finally, we use hospitals as sites of healing and to promote health. And all of our members are very passionate about what they do and passionate about patient advocacy. And this is one of the ways they can use their identity as medical professionals to further this cause.
And what kind of response or action are you getting, or you're seeing, or hoping to see from the South African government and the international community? Because your approach today is totally different to anything else that we've seen.
So we're hoping the South African government will do more in their efforts to engage with this issue, particularly with supporting initiatives to promote boycott, divestment, and sanctions. We really do want them to stop, in particular, the sale of coal and trade with Israel in terms of energy supply. And in terms of the international community, I think we're getting great engagement. People are doing this all over the world. People are protesting the genocide, particularly the intentional starvation that they're seeing, and this movement is actually gaining traction. And a lot of it was stimulated by the medical profession and has now expanded into broader areas of society. So I think overall the engagement has been overwhelmingly positive.
And beyond today's protests, how do you plan to continue raising awareness and solidarity for healthcare workers in Palestine?
So, of course, we're going to continue our advocacy and our education initiatives. I would also like to draw attention for and create support for the Freedom Sumud flotilla that has a contingent of 10 South Africans aboard this flotilla that is attempting to break the illegal Israeli siege of Gaza and to provide medicines and baby formula and essential services to the people of Gaza who are trapped within that enclave. And we'd like to see more support from our government and from civil society in supporting initiatives that are peaceful, that are led by civilians who are trying to help other human beings. So we just want this movement to create more of a groundswell and get more momentum. And we'd really like people to support initiatives like this that put non-violent, peaceful resistance and economic sanction against states that are not complying with international law.
And just, complying with the rules of the hospitals in the country, what sort of reaction are you getting from hospital management with regards to the protest action?
So there has been a bit of misinformation and a little bit of some scare tactics or intimidation tactics that have been used. We are attempting to open up channels for communication with management of certain hospitals. As healthcare workers, we are still South African citizens, and we have a constitutional right to protest publicly against issues that affect society. And the law is very clear in supporting our rights. And, we understand that we do have responsibilities to patients, and we do have responsibilities to clinical care and our employers. But our constitutional right to protest is enshrined, and if we can take care of our responsibilities and protest in a way that is befitting of the medical profession, we should still be allowed to have our say in how our country works and have our say in issues that affect us as a healthcare body and society in general. So we have opened up channels of engagement, and things have been looking quite positive, and we hope to continue having productive conversations about this.
Dr. Sterne, always a pleasure chatting to you. Thank you so much for joining us on Africa Update. That's Dr. Farzana Araie Sterne from Healthcare Workers for Palestine, South Africa, joining us on the line. It is 12:30 and our news headlines up next with Matapelo Mahape.
SABC News.